Hi, Hannah. How are you?
I'm well. How are you?
I'm nursing student in level one, and I would like to follow you.
Okay. I'm about to go to the machine to get some medications for my client. You want to follow me there?
Sure.
Okay. I'm gonna take my wow with me. Okay.
Okay.
Okay, I want to check the MAR here. Okay, so our patient is Marta Yarn, and she has two medications ordered. She's got
Okay.
sodium chloride ordered and some gentamicin, which is an antibiotic. So, well, first I want to wash my hands. And I'm going to go get her sodium chloride with potassium chloride 20 MEQ. So this is the right medication. We got the right patient, right dose, right route, and it's right time because it's due at 1400 right now. We're right on time here. It's due 1600, so 1506 right now. So we've got that. We've got to get her gentamicin. So we checked it. Expiration date is good. It's due expire next year. It's right patient, Martin Yarn. Right medication, right dose. 80 milligrams and 100 milliliters. Right time, right route, IV medication. I want to get some tubing for those. So we got a primary tubing and a secondary tubing. I think there's a hanger in there. I'll need our dial flow.
Wait, I think you already got it.
Okay, I think I got dial flow. We have it here. We're gonna head back to the room.
Oh, okay. But before going to the room, can you please tell me a little bit about your patient?
Sure, I can get my patient. Her name is Marta Yarn. She's 80 years old. Sorry. She's in room 529. She has no known allergies. She's a full code, and her attending doctor is Dr. Jolly. One thing I have to be aware of for her, she is currently on a regular diet, but she's going to be MPO up to midnight, so I just keep track of that, make sure she gets her enough food before then. She came in, she has a non-healing stage 3 wound on her sacral area. It is 4 centimeters diameter and it's 1 centimeter deep. It's full thickness, and she's scheduled to have a wound debridement tomorrow. That's probably why she's MPO tonight. She has a history of multiple admissions here for dehydration and pneumonia. And she was in pain when she came in, but we administered Percocet about 5 minutes ago, so her PHB level should be going down. She's slightly hard of hearing. She's alliterated times 4. She's Perla with some constriction, but brisk movement in her right and left eye. She has full range of motion, but she uses a walker. She has clear breath song, but she has diminished areas in her lower lobes. Her breaths are even and effortless. She has a non-productive cough. Her heart sounds are regular, no murmur. Pulses are 2+ in all extremities. She has less than 3 seconds for capillary refill. Her abdomen was soft to palpitations. Bowel sounds active in all 4 quadrants. She has complained of having a loss of appetite in the past couple weeks, so we want to give some education about eating the fine food that she likes. She voids on her own. She does have an IV, which we need because we can give her some IV drugs, medications today. She has IV in her right dorsal metacarpal, and we're gonna work on giving her some increased nutrition and some diet. She has a dietary consult tomorrow. For her labs, everything's normal, but basically normal, but she has high white blood cell count. It's 12,500. Her BUN is kind of high, it's 22. And her calcium is low. No, calcium is normal actually, it's 9.1, it's normal. She does have, her blood cultures came back, she has positive for E. coli. So that's probably why she's getting The enzymes on her albumin is 3.2. Her last vital signs were her temperature was 99.1, heart rate 88, O2 sat 92 on room air, and she's on, her blood pressure is 140 over 90. She is scheduled to have gentamicin, piggyback every 8 hours, 80 milligrams by 100 milliliters, and she has continued infusion of normal saline and 20 mg potassium.
She could, like,
Can I ask you a few questions?
Sure.
Okay, why is the client receiving this medication?
This client received medication because she tested positive for E. coli in her blood, so we want to treat that infection.
Okay. What action does the medication have on the body?
Gentamicin is the antibiotic, so it destroys the protein synthesis of the bacteria. So in other words, it destroys the bacteria. And she's also have the continuous drip of normal saline and potassium because gentamicin has a tendency to drop a person's potassium.
Okay, when should you question giving this medication?
You should question giving this medication if the person has an allergy to gentamicin or if they have renal insufficiency and they're on cephalosporins and penicillin, because this would lower the person's lower the action of the gentamicin. It would render it inactive.
Okay. Does the medication have therapeutic serum level?
Before you give gentamicin, you need to check the trough levels of the patient. If it's more than 2, you wouldn't want to give it because it could lead to toxicity of the patient. So we checked Miss March's levels and it was less than 2, so we were able to give her the medication.
Which vital signs should be monitored?
We want to monitor all of the vital signs. We want to pay attention to temperature, make sure it's not rising.
Okay. And which physiological parameters should be monitored when the med is given?
We want to measure the client's creatinine, the BUN, the ALT and AST, because these can gentamicin can cause these lab values to increase.
Okay. So, what intervention must be taught to the client to ensure the medication is given safely in the hospital setting?
The client needs to know, to kind of pay attention to the IV site, if they feel any kind of coolness at the site, could indicate that it's infiltrated, or if it's red, it can indicate phlebitis or warm. So we need to teach the patients about that and any side effects of the medication.
What about when the medication is given at home?
Usually IV drugs aren't usually given at home, but if she was taking antibiotics at home, you want to advise the patient to do the full course of the medication, don't just stop it if they feel better.
Okay, what are the side effects and potential adverse reactions?
Gentamicin, one of the adverse reactions, it can cause vertigo, which is like dizziness when you stand up, ataxia, weakness of the muscles, autotoxicity, and nephrotoxicity.
Okay. How would you know if the medication is effective?
We would know the medication is effective. Gentamicin takes about 3 to 5 days to work, so in 3 to 5 days the infection goes away. We would know that the patient's the medicine is working, or if the white blood cells count starts to decrease, we'll know the medication is working.
Okay, I don't have any more questions for now. Maybe later. I'll ask you more.
Okay, so we want to introduce ourselves to the patient.
Okay.
Hi, Miss Marta. I'm Ronda, your nurse today. This is Elizabeth, a student nurse. She's going to be following me today. Is that going to be okay with you?
Sure.
Okay, I'm going to give you your meds, okay?
Okay.
I'm going to wash my hands. Okay, so we've got 2 meds for you today. We've got your drip, your normal saline, and your potassium, okay? All right, we're going to, can you tell me your name and your date of birth? Or your age, please?
I'm Marta Yarn. I'm 80 years old.
Do you have any allergies?
No.
Okay. All right, you always want to check if you have the right patient.
Yeah.
Okay,
Very
so-
safe.
And we want to give her,
How many patients are you taking care of today?
well, I just have one patient today. It's a slow day at the hospital.
Okay, that's good.
Okay. Can you tell me your name and age again for me, please?
Marta Yarn, 80 years old.
Do you have any allergies?
No.
Okay. All right. That lines up with what's on here. Okay, we want to give the sodium. We want to hang the sodium first because it's a primary bag. Okay. I'm going to put some gloves on. before you give the IV drug, you want to always make sure that the IV is working, because you don't want to be hanging an IV and find out the IV is not working. So. Let's see. Alcohol swab in my pocket here. Got make sure the clamp's open. Clean it. I'm gonna make sure this is primed too. You want to put bubbles in here.
This is supposed to be that.
Okay, it flushes nicely.
No?
Yeah, I
You
see.
have to stay in there.
Perfect.
Okay, like get out.
How's your pain level, Martha?
I'm feeling a little better.
Oh, that's good.
Yeah, but can you like click, is it still gonna go?
We want to hang the,
And like go text or something like that.
the primary bag. So. Miss Marta, can you give me your name and age again for me, please?
Marta Yarn, 80 years old.
Okay.
Yeah, it should be next to the arm.
We didn't have an IV. Yeah.
All right, and turn green. That means you've got the right medication. So we want to do our 5 rights one more time. We always want to make sure we have the right patient we checked, right medication. We have the right route, which is the IV, right dose, 125 milliliters per hour, and right time, which is we're right around the right time here. Okay, I'm gonna hang that. And I'm gonna just wanna hang this upside down because it goes up. Too much too keep all of this sterile. I'm gonna take this and stir. I'm gonna pull that off. Pick this up. Picture that. Hang this. And then you want to make sure you prime the bag. And always when you open your tubing, you want to make sure you close it because they keep new tubing open so they don't get ruined when they're in storage.
That's what I'm like thinking. I'm like,
To the dial of flow. Make sure that's primed as well.
I was gonna try and tell you somehow, and I was like, I don't know.
Make sure all this is clean. Alcohol swab. Sterile. That is.
That says everything on one of the plates.
working. He's running. Yeah, I see he's running.
Okay.
So we just put it like.
We wanna. Clean it. Attach it to the patient. This should be running at 125 milligrams an hour. So we put it in 125. Make sure everything's open, that's not clamped, that's not clamped. And then we let that run. Make sure it's dripping.
Yeah, I saw.
Okay. Alrighty. So, you want to document that?
Oh, do you have your phone?
Alright. I'm gonna give you.
Oh, I'm recording.
Now, Miss Marta, I have another medication to give you. It's your
Put us here.
your normal saline, your gentamicin, your antibiotic. Okay. Have you ever had gentamicin before?
No, I don't think so.
Okay. So gentamicin has a few side effects. Okay. It might cause you to have some weakness, or it may make you a little dizzy when you stand up. So if you need to go to the bathroom, you want to put the call light on for somebody to come in and help you. Okay.
Okay.
Right. Can you tell me your name and age for me, please, again?
Marta Yarn, 80 years old.
I can't put this down. This doesn't go down.
Okay, turn green again. Got the right. So we're gonna check one more time. We got the right patient, right medication, right dose. So it's IV piggyback. 100 milliliters over 1 hour. Right route, which is IV, and right time 1600. So it's about 15:23 now. So we're good. We're good on time. Okay, so piggyback with this one. Sterile. Get off. Swipe the bag. So you want to backflow it. So we're going to backflow this. That's the backflow. You want to clean this above where the pump would be.
But then you just planted the horses.
Plant.
Is it it might feel like
Okay, so the flow for the gentamicin is 100 milliliters per hour, so we want to change that. Change the dose to 100. And then we want to unclamp this one. I want to tag that I put it in. The time.
Huh? It was
sure, come in.
long day.
I have everything in there.
100
Should I do?
mLs per hour.
She is in room 231. She's a
Put that on
patient
there, so
doctor.
next person can do that.
She
can also
came this
tag that one.
morning with high fever and chills. She is unstable. She is she's full cold. She is allergic to sulfa. Her
My
temperature
initials.
keeps going up. It's 101.1 right now. And
Alright.
her pain level
We'll
is
document
4.
this.
She's allergen oriented. She reports tingling in her lower extremities. She is 96 on the room air. Her vital signs are stable. We are waiting for them.
Miss Marta, can you tell me some of the side effects of gentamicin again?
Oh, yeah. If I have any weakness or ringing in my ears
Or you have any dizziness?
and dizzy, yeah, if I get dizzy, I'll call you.
Okay, sure, great.
Her
That's
temperature and her white
wonderful. That's good.
not normal. We have a few orders. The doctor ordered the lab work.
I'll be back in 8 hours to hang another piggyback for another gentamicin bag for you, okay?
And
Okay.
1500 fluid restriction. What else? We taking her vitals every 4 hours. We have to call the doctor if her temperature keeps going up, or it is above 101 actually, and it is above. She has the IV in the right arm. She's a little bit anxious. She's scheduled for dialysis. There's a nephrologist consult, and she has 3 times a week dialysis scheduled.
Alrighty, so document
And
that we
she's
give that.
she's diabetic also. Her glucose levels are
I have a few more questions for you. Are you?
I can answer, but I have to tell patient one more thing. Miss Marta, we're gonna come back in half an hour to check your peak levels to see how the medicine's working on you, okay?
All right.
Okay.
Yeah, you can answer your questions.
Okay. Were there any pertinent pieces of information you reviewed before giving the medication?
Yes, I did. I reviewed patient's trough levels of the medication before I administer it. If it was greater than 2, I wouldn't have given it to the patient because it would have caused gentamicin toxicity, which could lead to loss of hearing. So we wanted to pay attention to that.
Okay. Did this information affect your decision to administer the medication?
Yeah, like I said before, her trough levels were less than 2, so we were able to give the medication.
Okay. So did this information affect how you give the medication?
Well, I give the medication by IV bag, and that's the way it was ordered. So I gave it the way that it was ordered by the pharmacy and the doctor.
I don't have any more questions. Thank you about it.
Thank you. I hope you learned something today.
Yeah, sure.